Ancient Bells. Welcome to my channel, Learning Bells Live. Today we are going to talk about clinical anatomy. This is our next session on clinical anatomy, so let's begin. Our first term is paraplegia. Paraplegia, which is paralysis of both the lower limbs. Of both lower limbs. And that basically means you cannot walk. That is paraplegia. Next is monoplegia. The prefix mono itself suggests us that there is just one involved here, and yes, it is paralysis of any one of the limbs, be it this arm, that arm, or any of the legs, any of the lower limbs. That is monoplegia. Paralysis of any one limb. And we have quadriplegia as number 3. Quadriplegia. Here, the prefix quadri suggests that there is 4 involved here, and that means paralysis of all 4 limbs. Generally, after an accident, any one of paraplegia or quadriplegia occurs. That is paralysis of all 4 limbs, which tells us that we will be unable to do anything like a vegetable. We will be like a vegetable and sitting on a wheelchair. So now you might take a look at the board. Moving on to Anaesthesia. Anaesthesia. That means a state that is giving us a loss of sensibility. Loss of sensibility. You must have heard before surgeries, doctors give anesthesia, and why? So that the patient does not feel the pain of the invasive surgeries. But in ancient times, like Egyptians, they were quite good at anatomy. When they used to operate, there was no anesthesia, so the patients could feel the pain. Later on, we developed this drug. Anesthesia can be of 2 types. One that makes our entire body to lose sense, or in some cases we put localized anesthesia. That means the anesthesia given on the specific organ which we are operating. That was all about anesthesia. Our next term is Analgesia. Analgesia. That means loss of pain sensibility. Loss of pain sensibility. And that is analgesia. Next we have Thermanaesthesia. Thermanaesthesia. The prefix term itself suggests that there is something relating to temperature, and yes, it is loss of temperature sensibility. Loss of temperature sensibility. That means a person cannot feel anything, even if it's boiling hot, because there is loss of temperature sensibility. Now you may take a look at the board. Moving on to hyperesthesia. Hyperathesia. And the name and the prefix hyper itself suggests that it means increased sensibility, abnormally increased sensibility. That is hyperesthesia. For example, like if one person with hyperesthesia touches a warm cup of coffee, then also that person may say, oh my god, it's so hot. That kind of abnormally increased sensibility is called hyperesthesia. Next we have paraesthesia. A perverted feeling of sensations. That means, for example, perverted, the word perverted means to change in a bad way. So perverted feeling of sensations may tell us like, okay, the sensations are not happening correctly. They are not correct sensations, or it's not reacting as how it's supposed to react. That is paraesthesia. Next we have a very common term, coma. Coma is basically a state of deep unconsciousness. A state of deep unconsciousness. Of deep unconsciousness. That is coma. You must have heard people stay in coma for months to years. Like some people may even stay in a coma for 10 to 15 years, like that. It's such a state of deep unconsciousness. Now you must be thinking like, how do these people get nutrition, or how do they do their activities? How do their bodily functions occur? Well, their nutrition happens through veins. They get venous nutrition. Hence those packs of saline, the saline water, that will be kept attached to their veins. It will be injected in such a way so that it gets venous nutrition. So now you may take a look at the board. Moving on to very interesting tumors. And they have a fancy term called Neoplasm. So what are tumors or neoplasms? They are basically circumscribed, that means a specific location. Circumscribed. Non-inflammatory, that means they don't cause inflammation. Non-inflammatory overgrowth of cells. That is a tumor. Generally, tumors have overgrowth of cells. That means the cells are uncontrollably dividing cells. Dividing uncontrollably, so it is causing these tumors. Generally, tumors like neoplasms, they don't spread. Like we discussed about the suffix oma, that meant tumor. So this tumor or oma, the suffix oma, this indicates that does not spread throughout. It just stays in that specific location. That means it is benign, does not spread, stays in that specific position, so that it is easy to handle, like very common lipomas, osteomas, etc. Those are some omas. But there is a condition like carcinoma. Carcinoma is a cancer. There is a difference in between tumor and cancer. Tumors generally don't spread, but carcinomas, or that is the simplest type of cancer, but cancer does spread. It means that overgrowth of cells does not stay specific to that specific organ. It spreads throughout the body, causing life-threatening conditions. And due to its non-inflammatory property, hence it is very difficult to understand when a cancer grows, and at last we ultimately end up, most of the time, finding out the cancer at a very late stage, and it's too late to help at that moment. So that is the disadvantage of identifying cancer, but we may go for tests and see. Now, how come that some tumors are cancerous and some are benign? Some cells are there if they overgrow out of the cell environment. They cannot stay, like stomach cell. Let's say I get stomach cancer, then those cells can only divide. Let's say if it's a benign stomach cancer, it can only stay in the stomach environment. And if those cells divide in other environments, they cannot sustain. So hence those tumors are benign. But the cells which can sustain other environments, the entire body environment, those cause cancer. So now you may take a look at the board. Hope you enjoyed this episode, and please like, share, and subscribe my channel, and stay tuned for more videos. Thank you.